Chelsea Physic Garden in London is a public collection of around 5,000 plants, including their own licensed cannabis plant. So where better place to meet Dr. Dani Gordon? She has a PhD in integrative medicine from Harvard, and she's one of the world's leading experts in clinical cannabinoid medicine, having treated over 2,500 patients. But Dr. Gordon was not always convinced of its benefits.
I grew up in the United States in the war on drugs age. So it's a deeply ingrained fear that I had about cannabis. And this fear was exacerbated in medical school because instead of learning about cannabis as a plant medicine, I learned about cannabis in the only context actually that was ever mentioned was in the context of a drug that can cause potentially psychosis and addiction, and it's a very negative thing.
But Dani tried using a cannabis rub that she found at a medical conference to cure pain she had in her hand, and it worked. So she started prescribing cannabis to her patients in Canada, where it's legal to do so.
I went back from this medical conference thinking, okay, if this has had this effect for me used topically for a week, I have to add this to my practice. I'm really the first to say that cannabis is not a cure-all, and I do not believe it is such, but the kinds of things I was seeing happening with my patients, I can honestly say I have never seen these results giving someone an opioid or morphine or an SSRI. Every week, someone would tell me that this plant had changed their life, that it had saved their marriage, it had given their lease on life back again. They felt that their passion for life had returned.
But while medical cannabis in Canada and the US was available legally, in the UK it was not.